if there is something good for your child, you would fight to get that, right? You know, any parent would agree with me, I think. And this is something that my daughter needs desperately. You should sleep a little bit, okay? You better not sleep at school. Alice is 11 years old, and she's very smart, sweet. She loves music. She's inspiring. She's one of the strongest people that I know. She's gone through so much in her life, so many challenges. She was born seemingly healthy, but after about 3-4 weeks, we started noticing that her breathing was irregular. When she was 18 months old, we finally got the diagnosis of Rett syndrome. Rett syndrome is a rare, severe neurological disorder, mostly affects girls.
Studying.
So what she gets every day is this thing called airway clearance regimen, twice a day. It involves nebulizer and then chest PT, so it kind of shakes things up in her lungs. And then we can use a suction machine to suck out anything that was built in her lungs. She's nonverbal. She can't walk. She can't use her hands. She can't chew. She has developed seizure disorder, scoliosis, respiratory complications, and there's no cure right now. We've always had private insurance, even though it was pretty good. It would never cover everything that Alice needed. Between medications, hospitalizations, durable medical equipment, the medical costs were adding up to be anywhere between hundreds to thousands. I had to resign from my job to take care of Alice. The person who would take care of her would have to be medically trained, and we couldn't afford that, and our private insurance wouldn't pay for it. You know, Medicaid really has been a lifeline for Alice. When the nurse is here, the nurse is staying up all night, giving her the treatments that she needs.
Yay, it's over.
Because of this, now she has her own room for the first time. It also allowed me to go back to work. But more importantly, Alice is well, and she has not been hospitalized for sickness. She can spend her time with her brother and sister. She can go to school instead of spending weeks in the hospital. I want her to have an equal opportunity to live as an 11-year-old, even with her disabilities. That's the idea with Medicaid. Without the funding, it's not going to function as well as it is right now. And I know it's not perfect, and I know healthcare is complicated, but my daughter's needs are even more complicated. I cannot not fight for what my daughter needs.